everyone. This PechaKucha will explore the social factors that influence health disparities during the COVID-19 pandemic. This presentation will argue that systemic barriers such as socioeconomic status, access to healthcare, and occupational exposure influence the disproportionate impact of COVID-19 on minority communities. We will explore how these factors contribute to health disparities and discuss potential solutions. The pandemic has exposed and exacerbated long-standing inequities in health and social systems, making it crucial to address these systemic issues to improve health outcomes for all. Socioeconomic status plays a crucial role in health outcomes. Lower-income individuals often live in densely populated areas, making social distancing difficult and increasing the risk of virus transmission. High-density housing, limited access to resources, and financial instability are some factors that contribute to higher rates of COVID-19 infection and poorer health outcomes. Socioeconomic status also affects access to nutritious food, safe environments, and educational opportunities, further influencing overall health and well-being. Access to healthcare is another critical factor. Minority communities often face barriers such as lack of insurance, fewer healthcare facilities, and mistrust in the medical system, leading to delayed treatment and worse outcomes. These barriers result in higher rates of chronic condition and poor overall health. Historical and ongoing discrimination in healthcare settings has contributed to mistrust and reluctance to seek medical care among minority communities due to limited access to primary care, specialist services, and preventative care. Many minority individuals work in essential jobs that cannot be done remotely, increasing their exposure to the virus. These jobs often lack adequate protective measures, further heightening the risk for healthcare workers, grocery store employees, and public transportation workers, for example. Essential workers often face additional challenges such as a lack of paid sick leave, limited access to personal protective equipment, and higher stress levels due to job insecurity, which makes the risk of COVID-19 infection and transmission among essential workers higher. Environmental racism exacerbates these issues. Minority communities are more likely to live in areas with higher pollution levels, which can lead to underlying health conditions that increase COVID-19 severity. Proximity to industrial sites, poor air quality, and lack of green space increases vulnerability to respiratory and cardiovascular diseases. Environmental racism also includes unequal exposure to hazardous waste sites, contaminated water, and inadequate infrastructure, further impacting health outcomes. The article COVID-19 and Environmental Racism, Challenges and Recommendations highlights how environmental pollutants disproportionately affect minority communities, leading to higher rates of respiratory and cardiovascular diseases. The article emphasizes the need for targeted interventions and policies to address environmental injustices and protect vulnerable populations. The article "With COVID Spread, Racism Not Race is the Risk Factor" emphasizes that systemic racism, not biological differences, is the root cause of health disparities. Racism affects access to resources, healthcare, and safe living conditions. Understanding this distinction is crucial for addressing health disparities effectively. Data shows that Black, Indigenous, and people of color communities have higher rates of COVID-19 infection, hospitalization, and death compared to white communities. highlighting the stark differences in health outcomes among different racial and ethnic groups. The data underscores the urgent need for targeted public health interventions and policies to address these disparities. Socioeconomic barriers such as income inequality and lack of access to quality education contribute to these health disparities. These barriers limit opportunities for better jobs and health care, causing long-term effects on health and well-being due to socioeconomic disadvantages. Addressing socioeconomic barriers requires comprehensive policies that promote economic stability, educational opportunities, and social support systems. To address these disparities, policies must focus on improving access to health care, reducing pollution in minority communities, and addressing systemic racism in all its forms. Policymakers should engage with affected communities to ensure that policies are inclusive, equitable, and effective in addressing their specific needs. For example, expanding Medicaid, enforcing environmental regulations, and implementing anti-racist policies. Community-based initiatives can also play a significant role in mitigating these disparities. Local organizations can provide resources and support to those most affected by the pandemic. Some examples would be food banks, health clinics, and educational programs. Community initiatives can also foster trust, build social cohesion, and empower individuals to take an active role in improving their health and well-being, strengthening community resilience and support networks. In conclusion, the disproportionate impact of COVID-19 on minority communities is a result of systemic barriers. Addressing these issues requires a multifaceted approach that includes policy changes, community support, and a commitment to health equity. I encourage you all to advocate for and support initiatives that promote health equity. This can include participating in local health programs, supporting policies that address disparities, and raising awareness about the importance of health equity. Community efforts, partnerships, and collaborations can lead to meaningful change and improve health outcomes for all. We need to dismantle systemic barriers and promote social justice to achieve lasting health equity. This includes continuous advocacy, policy reform, and community engagement to ensure that progress is sustained and that health equity becomes a reality for everyone.